All right. So good evening, everyone. And let's start today's session of NEET SS and INISS 2023, an orientation session with the preparation strategies, right? So without wasting any more time, let's get started. Right. So first of all, coming to the outline of the session. So I'll be discussing 4 major headings in this session. Number 1, preparation strategies for both the NEET SS and INISS exam. Second, I will move on to the frequently asked questions by the exam appearing candidates. Third, we'll go on to the high-yielding topics or high-yield topics for NEET SS based on the recent NEET SS paper, that is the 2022 paper. And finally, the 4th heading will be how to prepare based on the Elite exam series, right? Okay. So you all are free to contact me for any academic doubts and exam related queries. So this is my WhatsApp and Telegram number, 9447334944. So I have separate groups for the NEET SS and INISS preparation, and we'll be starting active academic discussions in the groups. So if you are not a part of the group, you can just WhatsApp me. I'll add you to the group, and you can ask me any queries as well. So once I get free, I'll reply to your queries. So if I have not replied to the query, say within 24 hours, just ping me once again in WhatsApp, because sometimes, I might have missed your message. Okay. So let's get started. Okay. And this is my Instagram academic page, Dr_Rahul_Rajeev. So you can follow me there as well. Right. So first of all, moving to the preparation strategies for NEET SS and INISS. Okay. So first of all, I would like to tell you that when you prepare for an exam like NEET SS and INISS, always plan and prioritize your resources. So what are the resources that you have in hand? Number 1, video lectures. Okay. Now in the DocTutorials app, you have got the main video section, QRP session, T&D videos, and previous year question videos. Now, if you are a candidate preparing for both NEET SS and INISS, whatever be your first priority, I think main videos definitely are important. Now, I'll tell you one thing about the main videos. Now, the main videos, majority of the videos, we have started discussion right from the basics. Now, there is a reason for that. Both NEET SS and INISS, I want all of you to understand that there are a significant proportion of questions which are of easy to moderate standard. Because I have seen many candidates anticipating only tough questions or clinical scenario-based questions. And sometimes when they face the exam, they might face more trouble with simple questions. Maybe a simple question on a JVP, a simple question on a hard sound. So we want you to be thorough with the very basics also. So if you see the main videos, you have got simple basics. From there, we actually build it on. And if you look at the other videos, for example, the QRP sessions. Now, QRP sessions, I would advise all of you not to miss on that. If you are having a time constraint also, even if you skip some part of main videos, do not skip QRP videos. If you listen to the topper interviews of the previous session, I'm not saying this just to endorse DocTutorials, but majority of the previous candidates, they were very much benefited by the QRP videos. Why? Because See, medicine is a vast subject, and for you to read so much, it takes time. But in QRP sessions, where each topic has been discussed by the corresponding super specialty faculty, we have tried to concise it so that in a short span of time, you cover maximum points. So please go through each and every QRP session uploaded in the app. We have got QRP sessions for the medical group and QRP sessions for the INI. You should not miss out on these QRP sessions. Coming to the test and discussion videos, again, very, very important. Already in the app, you will have test and discussion videos, which are the test and discussion videos of the previous elite exam. Like last session, elite exam. What is the peculiarity of elite exam? Remember, we ourselves, the faculties ourselves have handpicked the questions and we have put it. So these are going to be very, very high yielding. So what I want you to understand is these test and discussion videos, which are already uploaded in the app, are very, very high yielding. And not just that, with the new elite exams coming up, those test and discussion videos will also be uploaded in the app. So I think, if you go through those videos, it is going to be very much helpful for you. Why? Because see, during your residency, you are used to learning theory stuff. But again, you have to go back to the MCQ mode. If you want to go back to the MCQ mode, you've got to know the approach to MCQs, how you should think properly, how to eliminate the options. So I think those test and discussion videos will help. And remember, please practice the previous year question videos. So in the DocTutorials app, you will also have access to the previous year question discussion videos. So I would advise all of you to please go through the previous year questions, because I would advise this even before looking at the main videos. There is a reason for that. In this vast subject of medicine, you have got to know in these exams, NEET SS and INI SS, where are the questions coming from? What are the hot topics? What are the commonly repeated topics? So to have an understanding, and then going to the main videos and QRP videos will improve your perspective. But if you go the other way, like, you think that I will first start off with Harrison, then read the entire Harrison, that would be difficult because you are again wandering in a big forest. So if you know where to focus, what to focus, I think it makes life a lot easier. So the point I want to convey to you is that, when you watch the videos, not just DocTutorials platform, whichever platform you are following, I think it is important to focus on what is more important. One advantage of DocTutorials is it's not just about the videos, main videos alone. I don't think in any platform you will find these variety of videos, main videos, QRP sessions, test and discussion videos, and previous year question videos. And to make it more simple for you, we are also introducing in a month the Harrison tables and flowcharts video. Okay, so Harrison tables and flowcharts. Now this again, so what we are going to do is each super specialty faculty will be discussing only the tables and flowchart from Harrison. Precise and concise discussion, so that I'm sure that being residents, that Harrison, they often ask questions from the tables and flowcharts. So we'll be having specialty wise discussion of tables and flowcharts from Harrison, and it will be arranged in the specialty wise order so that it will save a lot of time for you. So a new addition will be the videos of Harrison tables and flowcharts, which is going to be uploaded in a few weeks' time. Okay, so this is one. Next is question bank. Please go through the question bank. There are good number of questions, but I just want to tell you one thing. See, many students, while preparing for the NEET SS last time, they thought that the question paper will be mainly clinical. So what they did is they went hunting for only clinical scenario based questions. I have always stressed in my sessions, never, you believe the National Board of Examinations for the predictability of the exam pattern. They keep changing. A paper might be more clinical, the next paper might be a mix of factual and clinical. So the good thing about the QBank is that it is having a mixture of questions. So whatever QBank, whichever platform you follow, make sure that you are practicing a good mix of clinical scenario questions, image-based questions, and factual questions. Okay, this is very important. Then Elite test series is again a high priority. The last year questions will be there in the app. New fresh questions of the current Elite series will also be there. You should not miss out on this. Grand test, you might have seen already the timetable of the Elite exams. But remember, along with those module-wise exams, soon we'll be also having grand test as well. Now, Harrison textbook is there, super specialty textbook is there. So what is the title of the slide? Plan and prioritize your resources. At least some of you will be in the final year MD medicine. Some of you might have already done with your MD or DNB medicine, or maybe even other branches like say pediatrics, aspiring to take an adult specialty, or even pathology and biochemistry also eligible for clinical hematology. So what I want to tell you is, you have got all these resources. Now you have got to prioritize, because suppose if you are a candidate who is already well versed with Harrison, then you can skip some of the main videos and focus on the QRP sessions. At the same time, if your basics are not so thorough, focus on the main videos. Test and discussion videos, previous year question videos, everyone should watch. QBank. Now, QBank, in a short while, I will be telling you how to approach the QBank. So, but what I want to tell you here is, see, about Harrison and the super specialty book, I will not advise any candidate to first look at Harrison or read the entirety of Harrison and then come to the main videos or QRP. I would always suggest go through the main videos and the QRP sessions so that you already have a concept. And from there, then you read Harrison, it will save a lot of time. The other way around, I think it might take more time than you anticipate. Okay, so the title of the slide is to plan and prioritize your resources. Let's go to the next slide. So next is about frequently asked questions of exam appearing candidates. So I know the questions that you are likely to ask me. So some of them, I have myself framed as questions, but if you have more questions, please feel free to ask me in the chat box. Okay, right. So first of all, you might ask me, how are the pattern of questions in these exams, means the NEET SS and INI SS. Remember, in both these exams, you can have clinical scenario based questions, factual questions, and image based questions. The paper in both these exams are likely to be a mix. Now, let me tell you one thing. When it comes to INI SS, I'll be first talking of INI SS neurology point of view. Let me tell you, if you take the last 3 exam papers of INI, there has been variation in the toughness of the paper, because one session the paper was slightly on the tougher side, but the exam before the current one, I would say, was very simple, mostly from Harrison and just a few questions from Bradley. So I want to tell you that both for NEET SS and INI SS, there is always an element of unpredictability. By which I mean, if you just look at the one question paper before, there is a chance that you might get a wrong information on the pattern. So there is always an element of unpredictability. Now, you might ask me, sir, you're saying about unpredictability. So how can you give us more light on what should we be focusing at? Let me tell you, if I was in your place, what I would have done is I would have prepared myself so that I can handle a sufficient range of questions. Now, what do I mean by this? By my preparation, I should be able to handle questions which are easy, moderate, and tough. Well, that means all of you have to put in genuine amount of effort. I know that many of you might find it tough to study like you did before for your NEET PG exam or INI exams. But the thing is, you have to go back into that mode. I know that at this phase of life of yours, where you have more responsibilities also, spending so much time in front of a book is not easy. But please remember, this is a very important exam and you have to go back to that mode. So only if you go back to that mode, the range I'm talking about, like you must be able to tell yourself the day before the exam, whatever type of questions come, I think I am capable of handling it. Because if you do not prepare to that level, I have seen candidates preparing only clinical scenario questions and only reading super specialty textbooks. And when simple questions are asked regarding a paradoxical split of the second heart sound, suddenly, they got it wrong. So I would require you to put in effort so that you have a good range. If it is a paper with predominant factuals, you should be able to handle it. Predominant clinical scenario questions like the NEET SS before the current one had so many clinical scenarios, which was not the case the last time. So I am telling you, please be prepared for everything and do not make assumptions just looking at one of the previous papers. Okay, so that is what I want to tell you. Now, if you ask me, sir, NEET SS, 150 questions, INI SS, you have around 90 questions. So how do you see the preparation level in these two exams? Let me tell you, there is one thing I want to warn you about. Many candidates preparing for INI, they think that, see, for INI, if you take INI SS exam, usually what happens is out of the 90 questions, around 55 questions are from the super specialty subject, SS subject, and around 25 questions are from the general medicine. This is what we have seen in the last few sessions. Now, the point I want to tell you is this general medicine part, some candidates feel, well, I focus on the SS subject. If I want neurology, I focus max on neurology. General medicine, I try to answer based on my existing knowledge. My dear students, please understand, medicine questions of INI are also of reasonable standard and they are also rank deciding. It has happened in INI papers where suppose in INI neurology, the neurology part was relatively simple and the medicine questions became rank deciding. So I want candidates to understand, even if your priority is INI and not NEET SS, even then medicine is important. Don't think that just you're planning for INI cardio doesn't mean that you can keep medicine aside. I would advise all of you to study medicine very thoroughly also, because each question matters. So I don't want you to miss out on that. Okay, so I hope that is also very clear. Right, let's move forward. Now, I know that a good number of candidates listening to me will be final year MD candidates or DNB candidates. preparing for the exam. You might ask me, you are reading Harrison well for your MD or DNB exam. Is it an advantage? Definitely you are an advantage, no doubt about it. But the only thing you should be careful about is when you prepare with Harrison for your theory exams, you're not practicing MCQs. So what I want you to understand is, suppose you are preparing for your final MD or DNB exams. While you prepare nephrology, please make sure you solve the question bank of nephrology. So in doc, we have a question bank. Please solve the question bank of nephrology. Even if you don't get time to watch the video modules because of time constraints, never miss out on maths practice. Now, I told you a while back, I'll be telling you the approach to Q bank of DocTutorials. What you should understand is, if you look at the medical group Q bank of DocTutorials, you will find that there is a general medicine part. In the general medicine part, there is a fundamentals and there is super specialty. So in the medical group, the fundamentals means, suppose you are taking neurology. So neurology section of the medical group question bank will have fundamentals, means questions based on Harrison alone. 21st edition, latest edition of Harrison with all references. You will have questions based on Harrison alone. So if you are having time constraints, just stick to the fundamental question. However, if you are a good candidate who is already reasonably prepared, you can go to the super specialty aspect as well. Now that has selected questions from the corresponding super specialty, by which I mean, see, even for NEET SS, you will have questions outside Harrison. All the questions may not be from Harrison, because once we discuss the high yield topics in due course of this session, you will understand that even from the super specialty books, they do ask. So if you do not want to read a super specialty book, what you can do is you can solve the question bank and go retrospectively to the super specialty textbooks. Now, based on the feedbacks of many previous batch students, they told me that, the super specialty aspect of the medical group Q bank helped them retrospectively go to the super specialty textbook. If you want to say take NEET SS nephrology, even then you appear for 150 questions. But see, suppose you already have the INI also in mind, reading or going through the super specialty Q bank will help you go retrospectively to Fihali or Brenner for nephrology. So that is what I want you to understand. So this will be for the NEET SS part. But if you are having time constraints, limit your preparation to fundamentals. Now for INI SS, there is a DM question bank. For example, you are mainly targeting neurology. In that case, go for the DM neurology Q bank, where the questions are there from Bradley. So here again, reading Bradley cover to cover is not something you can do. Let me be honest, no neurology resident during DM or DNB at the end of their course can confidently say that I have read the entire Bradley. It's not possible. So in your case also, what I want you to understand is, even if you have an eye on INI neurology, I think it's always better to go retrospectively from the Q bank to the textbook. That is a better idea. Okay, this applies to all specialties, whether it be cardiology, nephrology, whatever specialty. I think that should be your strategy. Okay, right. Now, next is a common query. Is it a must to read super specialty textbooks? Let me tell you, if you are only preparing for NEET SS, I would not say that it is a must. But you might ask me, sir, you said a while back that the questions might not come from Harrison alone, might come from outside Harrison. So if I don't read super specialty textbooks, won't I miss out? I want you to understand that if you look at the QRP sessions in DocTutorials, the QRP sessions, the corresponding super specialty faculty have concisely given you important points even from the super specialty textbook. So if you are again running short of time, I would advise, in addition to Harrison, to watch the QRP sessions, which will definitely give you an extra edge. Now, for INI, however, you can expect direct questions from the super specialty textbooks, especially from the flowcharts and high yield tables. Now, as far as my subject, as far as neurology is concerned, even in my routine lectures, I have covered important points from Bradley as well. So you need not worry. Now, you will definitely have in the Harrison table discussion that we are coming up. So that tables and flowcharts will also be covered. Now, for Bradley also, I want to tell you that definitely the discussion videos that we are going to conduct in the Elite, relevant tables definitely we'll be discussing in that as well. Okay, so you need not worry regarding that. I will not advise a cover to cover reading of super specialty textbooks. Even INI candidates, I would always advise a retrospective reading. Yes, INI, you have to go through the corresponding super specialty textbook. Okay, right. Now, next question, where to practice image-based questions from? Well, in the image-based grand test in DocTutorials, you will find that there are specific image-based GTs in the question bank session, and also in the Elite exams that we are conducting, we will be putting image-based questions as well. So you need not worry regarding that. All the image-based questions will also be covered, right? Okay. Now, watching video lectures is time consuming. Can I go for QBank alone? It's a common query. Now, I'll tell you one thing. Rather than skipping entire video lectures, once you go through the videos of previous year question topics, now, once you go through the PYQ topics, previous year question recall videos in the app, you will understand, okay, these are the high yield stuff. Now, I'll do one thing. These topics, I'm not very thorough with. So selected topics which are high yielding, please go and look at the main videos because you don't want to miss out on that. For example, management of an acute stroke, or management of a myocardial infarction. A topic like JVP, sometimes, you might be wanting to have one more look at it. So don't miss out on the videos of previous year question topics, okay? So, and from there, you can then decide which all videos you can watch in the main section. Again, I will stress, even if you don't watch any of the main videos, you cannot skip out on the QRP videos. I think they are of very high yield and will help you summarize the entire subjects. Now, the Elite test and discussion videos of the previous session and the ones that we are going to conduct now, both are important. Please go through it. Okay. So the answer to this question is, can I go for QBank alone? Depends on your current preparation and the time you have in hand. But let me tell you, if you tell yourself that I have less time in hand, I will also ask you a question. Are you utilizing your time effectively? Because many a times I know that when we learn, you might have your WhatsApp or Telegram on and you have notifications. So concentration might not be that good. So to sit at a stretch and learn, are you doing it? That's what I want to ask you. If your answer is no, please correct that. Because see, it's a big exam, and if you put in your effort, you will definitely be able to crack it. Okay. Now, how important are giving grand test? Now, this, let me tell you, my dear students, do not wait for completing your first round reading to start giving grand test. Because only if you give grand test, you will get an understanding on where you stand. Now, if you look at the DocTutorials platform as well, there are multiple grand tests that are going to come. Multiple grand tests are going to come. And you please attend the grand test. Even if you are not prepared and you fear that if I give this exam, my rank might not be good. score might not be good. It might actually be demoralizing to me. Please don't take it that way. What you have got to do is just give the exam with all sincerity. Look at where you have gone wrong, see your rank, how many questions you have got right, and assess with last year ranks, and then you can adjust accordingly. Otherwise, if you don't give your grand test and you give it only towards the end, it might be difficult to make certain changes in your preparation. But suppose you give a grand test and you find that you thought cardiology you were doing good, but you are getting many questions wrong from ECG. Well, if you do it towards the end, you might not get time to change your study strategy. So please start giving grand test early itself. Okay. And when you give grand test, be in your room. It should be in an exam atmosphere. Phones should be switched off, and then you actually give the exam. No distractions. You give the full exam. That is very, very important. Okay. Now, once again, I would emphasize the importance of elite exams. Just go through the previous year toppers video. They will be definitely telling two main highlights in doc. That is, one is about the QRP videos and the elite exams and the test and discussion videos. I think these exams are very, very high yield because nobody else is putting, we are only putting the questions. So those questions will be very relevant also for you. Okay, right. Now, next, I have done my MD or DNB in pediatrics or maybe other branch, and maybe I'm eligible for some of the branches in medical group. How is my chance in your medical group? Well, this depends on your effort and dedication. I have seen some candidates doing exceedingly well as well. So some candidates doing unbelievably well. I don't think it is not possible for you. They have got even single digit ranks as well in the recent exam. So it depends on the effort that you put in. Now, for you, I have got two suggestions. Number one, for you, don't start reading Harrison cover to cover. For you, you must watch main videos. There is no substitute. All right. So for this question, for those candidates who have done MD or DNB in pediatrics, I want to tell you two important points. When you read, please go through the main videos. No substitute. You have to watch the main videos. Because as a candidate not from medicine background, you might have to think a certain aspect or imagine certain scenarios and then study. So first watch the video lectures, and then for you, definitely only then go to Harrison. Never start reading Harrison because it might take more time for you. You have to watch the main videos itself. Now, also the second point for you is please practice clinical scenario-based questions, because I think you might find it easier for the factual questions once you do your main videos and practice question bank for you, but slightly emphasize more on the clinical scenario-based questions, because that is where you are likely to find it slightly tough. Okay, done. Now, we are done with that, and next we are coming to the third heading of this discussion, high-yield topics for NEET SS. Now, I want all of you to focus now. I am just going to brush through the topics that were asked in the recent NEET SS exam. And once I am done with these topics, I will tell you what are the take-home messages for you based on the previous exam, right? Let's go to the questions. Now, this is based on NEET SS 2022 recall. And first of all, coming to the overall analysis of the question paper. Overall, the NEET SS 2022 paper was of moderate difficulty level. But an interesting point is that there were more factual questions than expected. I am not saying that there were not clinical scenarios, but more than expected factual questions were there. See, the exam was slightly tilted to factuals than clinical scenarios. I told you many candidates expected lengthy clinical scenario-based questions. Now, next time, the upcoming NEET SS, you might find a clinical predominant paper. That is why I want everyone to have a good range while you prepare, which will help you answer any type of questions with ease. Okay. And also there were more than expected questions on genetics part. Genetics usually in NEET SS exams used to be neglected, but the current NEET SS exam, that is 2022, had some good number of questions. That's why I have specifically listed it as a point. Now, the paper was more favoring readers than thinkers. So what is readers and thinker? So basically, once you are done with your residency, from an academic point of view, well, there may be certain candidates who are voracious readers, like they have done Harrison very, very thoroughly, line to line reading of Harrison, and they are mostly readers for me. Okay, this is my own arbitrary classification. Thinkers means they are very good candidates, but their strength might not be a line to line reading of Harrison, but their strength might be thinking logically and answering. Yes, definitely there will be good number of candidates who are both good readers and thinkers, but I'm just telling you, the paper slightly favored the readers, because once we go through the questions, you will understand some of the lines were directly handpicked from Harrison, and unless you did not read that, you would not get it right. I'll actually show you the examples as well. Okay, now let's go to the neurology questions part. Okay, so the neurology questions, if you see, there were around 24 questions from neurology. And let me just quickly go through the topics. 2 questions were from trigeminal neuralgia, 1 question from cluster headache. So headache topic had 3 questions overall. Ataxia topic had 2 questions. 1, ataxia with vitamin E deficiency. 2nd, Wernicke's encephalopathy. From the neuroinfections part, questions on mollaret meningitis and progressive multifocal leukoencephalopathy. Stroke, I'll tell you, it was a bit of surprise. To be honest, I always tell candidates that in neurology, you are definitely going to have good number of questions from stroke. But contrary to my expectations, only 2 questions came this time. All the previous NEET SS or INI SS you take, stroke will have reasonably good number of questions. But 1 question asked here was on the contraindication for thrombolysis, and the second was on the location of the AV malformation bleed. These were the 2 questions on the cerebrovascular diseases module. From the epilepsy part, there was a question, a simple one on mesial temporal lobe epilepsy, and a very important point that I specifically stressed in the QRP session also on GLUT1 deficiency leading on to seizures, and as a part of treatment you give ketogenic diet. That question was asked, and for those candidates who had listened to the QRP videos, they got it right. Then about valproate hepatotoxicity, there was a question with myelopathy with optic neuritis, likely a demyelination, at a clinical scenario. There were 2 clinical scenarios based on motor neuron disease, important. And second one was slightly a twisted one. You can go through my recall videos, but students who knew the concept well answered correctly. There was a question on botulism, and then again, many students messed up that question. They messed it up with diphtheria. But in the video section where I have discussed these questions, I have specifically told you why it is botulism and not diphtheria. A question on myotonic dystrophy was there, and a question on side effect of statin, which is a relatively rare side effect as far as statin is concerned, on tendon rupture. But again, that would I would say that only someone who is well versed with reading papers, they would actually know this, because it's not commonly mentioned in textbooks about tendon ruptures as a side effect of statins. Commonly, fluoroquinolones are the ones which are having the tendon rupture as a side effect, but statins can also cause it. So even in my video lectures also, I have not specifically mentioned about tendon rupture. So only if you have specifically read about tendon rupture, you will be able to answer it. But I would again tell that question was not tough because you could easily eliminate the other options as well. A question was there on delirium tremens, and a trinucleotide repeat expansion disorder question was there. Though this is a genetic question, I am putting it here because all the options were neurological disorders. And again, this is very important, Apert syndrome and biotinidase deficiency. Now, these two questions were from the pediatric neurology part. Now, when I put elite exams last time, I made it sure that I put a few questions from pediatric neurology. So these two questions came from pediatric neurology, and candidates, biotinidase deficiency, I had put in as a specific question for the INI exam series as well. I put a specific question on this biotinidase deficiency, and that was asked as well. So these are the neurology questions that were asked in the NEET SS. So you see, overall neurology had a good question distribution from all topics, and most of the questions were answerable with a few tougher questions, okay, especially the questions on pediatric neurology. Coming to cardiology, two ECGs, one ECG of a RBBB with a LHB, an ECG of a 2:1 AV block. Third question, you can put it in the endocrinology perspective or the cardiology perspective regarding the cardioprotective action of empagliflozin. Even in my videos also, I have told you diabetes with high risk vascular risk factors for atherosclerotic cardiovascular disease. Empagliflozin is very useful. You know about the famous EMPA-REG trial. Then a simple question on paradoxical S2. They asked a question like this: which of the following is an indicator of the severity of aortic stenosis? And one of the options was paradoxical S2. Two questions on JVP, one on the CV waves of tricuspid regurgitation, and second concerning the Y descent in tricuspid stenosis. Then a question on Laplace's law, that is systolic pressure proportional to LV pressure and ventricular diameter. Then they asked a question on the pharmacology part, the IV class 3 antiarrhythmic with additional action on the sodium channels, butylide. Question on the management of inferior wall MI, not a common cause of aortic regurgitation. The answer was SLE. Patient on HIT being planned for angioplasty, what anticoagulant will you prefer? Bivalirudin. Sine wave pattern is seen in which condition? It is hyperkalemia. RBBB can occur physiologically. So they give a clinical scenario of a 30-year-old male, and with all other investigations being normal, and they asked what is the likely ECG finding? Right bundle branch block. J point elevation in hypothermia was asked. Carpentier classification, even in my video lectures in the medicine part, I have discussed this Carpentier classification in the module on mitral regurgitation. Because if you look at my cardiology modules as well, it's not just Harrison based. I have taken important relevant points from the corresponding super specialty textbook. So Braunwald has Carpentier classification. I have included that in my video lectures as well. A simple question on Fagett sign. See, Fagett sign or relative bradycardia, you are hearing it maybe from your second year of MBBS. But that's what I want to make you understand. You can expect even NEET PG level of questions. That is why in the video lectures, if you see, some are very basic discussions, but don't neglect. You will get questions from that, and sometimes you may make errors which nobody else would actually make. So that is what I want to tell you. Don't forget the main video lectures part. And not an infectious cause of AV block. So they mentioned about Lyme's disease. They mentioned about diphtheria. So the answer to the question was HIV, which is not known to produce any AV blocks. And they asked questions about ECG and electrolyte disturbances. Like in the options, they asked about hypocalcemia and QT interval, hypomagnesemia. So the question was like that. Okay. So cardiology, let me tell you, again, a very good question distribution, really tested the knowledge. So clinical scenarios were there, factuals were there, and only if somebody had a good idea, I think you would be able to get most of the questions right. Hematology part, the prognostic markers of AML, 2 questions on AML. One was on the prognostic marker and second was on the which subtype of AML has the best prognosis. Question on CLL on the Rye staging, acquired von Willebrand disease. Again, I still remember the hematology questions also. We had a similar question on a patient developing an acquired von Willebrand disease. Drugs used in Hodgkin's disease, post bone marrow transplantation. They asked a question on an infection that happens in the 2nd month, that is the cytomegalovirus, again directly picked from a table in Harrison. RSL image-based questions and Duvalier score. I think, Shinto sir in his QRP session had specifically mentioned regarding this. So those students who attended the QRP, they got this right. So drugs with definite risk of hemolysis in G6PD deficiency. Again, there is a table in Harrison where drugs with definite risk. So they have specifically segregated, and there was a question from that. 2 questions from methemoglobinemia, 1 question from iron deficiency anemia, a simple one, and they asked regarding a side effect of darbepoetin as well. So hematology, again, good distribution with 1 or 2 tough questions. That's it. Okay, rheumatology, I think, and immunology, all the rheumatology questions were very simple. Causes of positive anti-nuclear antibody, a question on treatment of rheumatoid arthritis. In my lectures, I've shown you the algorithm of management as well. Reactive arthritis, fibromyalgia question, giant cell arthritis question, cryoglobulinemia and association with HCV virus, pigmented villonodular synovitis. Now, PVNS, I always tell my students that in the rheumatology segment in Harrison, one area that every year they put a question is on pigmented villonodular synovitis. So don't miss out on that. SCID, the most common pattern of inheritance, and the ligand for toll-like receptors, where the questions asked from the immunology point of view. GIT and hepatology, you had question based on staging of cirrhosis, management of severe alcoholic hepatitis, AIH simplified score. Then a question again that was from a super specialty textbook. So that was from Schlesinger, hepatitis B virus patient. He is already on rituximab, which is a B cell depleter. And what should be the duration of antiviral prophylaxis? In the table in Schlesinger, they have mentioned about 6 to 12 months should be, so there has to be an extended treatment. And 2 questions from Budd-Chiari syndrome, a question on liver enzymes. Again, that was handpicked from the Schlesinger textbooks. So whatever I am telling were handpicked from super specialty textbooks. That is where you would require the help of a teacher. It's not possible to entirely go through the corresponding specialty textbook, but we'll be definitely helping you to focus on what is important and what is likely to be asked. Okay. Now, there was a question on the accelerated hepatitis B immunization schedule. So there was a controversy in relation to the question. The name of the vaccine was not mentioned. And if you go through the videos, I think Dr. Niyaz sir has discussed this question in the infectious disease part, and also Prashant Gandhi sir also has discussed this question. And one problem with that question was that they did not mention about which vaccine. Then HCC, there was a question based on the treatment, based on the Milan's criteria, and not an association of HCV was asked. Then asymptomatic HCV, the management. So a few questions from hepatitis C viruses. Lilly model was asked, the cell responsible for fibrosis and liver cirrhosis. See, it's a very simple question, stellate cell. But if you look at my video lectures in the gastroenterology part, I have mentioned about the mechanism of cirrhosis. I know that some students, might have just neglected that particular video thinking, oh, this is pathology only. But they asked a question and some students got confused on what is the actual cell responsible for fibrosis. Right. And then one question on the diet in exocrine pancreatic insufficiency. There was a question on mortalin receptor agonist, erythromycin, an image of an ERCP of choledocholithiasis. I think, this you will have to watch the QRP sessions also definitely, and it will definitely help you. And there was a question on total parenteral nutrition. They asked about the true statement, a question on Crohn's disease, and a question on ileal resection and what is the associated vitamin deficiency. Okay, so again, if you see in the GIT and hepatology, you had questions from Schlesinger as well. That's what I want to tell you. All questions are not from Harrison, but you will understand that there were certain questions which were handpicked from Harrison as well. Okay, right. Coming to endocrinology, again, if you see endocrinology, there were some tough questions. So drugs preventing onset of type 2, metformin is the answer. There was a controversy with pioglitazone, but I think the best answer definitely is metformin. Dr. Karthik also has discussed the question in his in the recall video. A clinical scenario of a neurofibromatosis type 1 with a hyperparathyroidism, a question on men 1. See if it is NEET PG or NEET SS, there has to be a question from multiple endocrine neoplasia, right? So a clinical scenario question on central diabetes insipidus, a clinical scenario question on partial nephrogenic diabetes insipidus. Again, only if you are thorough with the topic, you will be able to understand. I think, in the recall videos also, it has been discussed beautifully by Dr. Vivek and even Dr. Karthik also. So a duration of insulin action in hyperkalemia, that was asked. Question on Laron syndrome, a question on menopausal hormone therapy. A patient, a female with a non-proliferative diabetic retinopathy, they asked about which contraceptive method you would prefer in this patient. A question on the type of mutation in achondroplasia. Now this again was slightly tough. People would learn about the clinical features of achondroplasia, but what is a type of mutation? That is what they wanted to know. Then they asked about oral GLP-1 analog, a question on primary hyperaldosteronism, a question on Hurler's syndrome. Again, a very factual question on the daily water requirement per kilocalorie of energy used. So those were very factual questions. From the nephrology point of view, a question on KDIGO AKI staging. I always stress this in my lectures. I have covered it. Dr. Vivek also has covered it. Then a question on Barter's syndrome, a question on Riddle syndrome. Now, these are very, very important. You can even see that in YouTube also, we have shared one free video where Dr. Vivek is discussing about the renal tubular acidosis and the channelopathy. It's a beautiful video. I would suggest everyone to go through it. And he has handled the topic wonderfully well in the medical group videos as well in the nephrology part. So I think it's very, very important and you have to watch the videos. Then a question on HIV patient with a collapsing FSGS. Then a characteristic of dilysable toxin. I think even Dr. Vivek did a snippet, I think a quick learning bite based on this as well, which is why I want you to be connected with the faculty. See, we have formed all these WhatsApp groups, everything for a reason, because once you find a doubt, you want to discuss, the faculty will be there for you. Now, obviously, we are all busy with our practice as well, but once we are free, we'll definitely reply to you. And I think Dr. Vivek has specifically stressed on this point as well, on the important characteristics of a dilysable toxin. Then an expected question on the pre-renal acidemia lab parameters, again from that table in Harrison, comparing it with the intrinsic AKI, that question was asked. There was a simple question on Fabry's disease. There was a question on ADPKD where multiple statements were given and you were asked to pick the false statement. There was a question on marble brain disease. I put it in nephrology because you have got renal tubular acidosis as an important manifestation. A post-infectious glomerulonephritis, an ABG question on an acute respiratory alkalosis. But again, there was one controversial point with regards to the ABG, which we have discussed in the recall video section. A question on malakoplakia, a very simple question on minimal change disease, nephrotic syndrome management, which I think even an MBBS student would write. Question on urine anion gap formula, again, formula, factual question, but again, it's very, very important. From the infectious disease point of view, a question on IMN clinical features. Now, this question on leptospira nephropathy, it was specifically handpicked from Harrison, because there is magnesium loss and that specifically causes hypomagnesemia, and that specifically is a line in Harrison that itself was asked. So that's what I want to tell you guys. You have got to have a good range. Don't just go in one manner alone. Go through the last few years question paper. Understand that they do ask a range of questions, and prepare yourself so that you are able to handle all sorts of questions. A patient with CMV with GAN cyclovir resistance, what is the treatment? Then a scenario of a patient having an antibiotic usage and a cholestatic clinical picture or lab picture that can happen with amoxicillin clavulanate. Treatment of Plasmodium falciparum malaria in pregnancy was asked. And again, a simple question on larva currents. And this question on TB pleural effusion, you will find is a ditto question from Harrison. They've asked which cell is least likely to be present in the pleural fluid. One option was regarding lymphocyte, one was regarding neutrophil, one was mesothelial cell. And Harrison specifically says that mesothelial cells are never seen. So that again tells you have to be thorough with Harrison as well. A question on Banward syndrome. Another question was there on leptospirosis, which was different from the nephropathy question. Then a clinical scenario based question based on curve 65. So it is again a NEET PG level question only. They have given a scenario and they've asked, where will you manage? Will you manage in the ward? Will you manage in the ICU or OP? Now, this is what happens when you learn for NEET SS. Sometimes you may neglect these simple stuff. You might remember curve 65. I learned it long back, but that's what I am saying. The stuff important for NEET PG are important in NEET SS as well. Yes, you may get additional questions, but for a candidate, all sorts of questions are important. Even if it is a simple NEET PG level question, or if it is a NEET SS level question, both carry the same marks, and you cannot miss out on the simple questions. PCPO pneumonia, indication for steroids, varicella, HIV part, Nia sir has beautifully covered. We have added some new videos in the infectious disease part. We are keeping on adding new videos, removing certain old videos and replacing with new ones, so that, if at all there is some guideline change, you are all updated. So keep a close watch on the videos, and be in the WhatsApp groups as well, so that whenever we have some additions and all, we'll definitely let you know. And then there was a simple question on varicella as well. So the last part is on how to prepare based on the ELITE exam series. Now, this is something I want to tell you. Now, first of all, if you ask me, sir, if I attend ELITE exam series, what percentage of questions will come from ELITE exam series? Let me be honest with you, I don't know. But these are questions which we are putting. So when I am putting a question, I would anticipate, okay, this is likely to come. But please remember, more than the questions alone, the importance of ELITE is that it gives you a timetable. Again, if you watch the topper interviews, the problem is if we just gave you a lot of video lectures alone, you will find it difficult to complete. The importance of ELITE is it gives you a direction, it gives you a timetable. You are forced to finish a particular topic within a particular time. And whatever said and done, you have to finish and give that exam that day. So it forces you to a discipline. Because see, when you were preparing for NEET PG, you were more than capable of enforcing discipline on yourself. But at this point of time, you might find it slightly difficult, which is why we are giving you a timetable. So I want all of you to prepare for the ELITE exam timetable. And if you look at the timetable, which we have already scheduled, the entire exam schedule has been released, including the topics. And that is the importance, because see, usually when someone conducts an exam series, you release portions then and there. But here, the entire portion list has been released. And very soon we are going to release the topics module wise, including the date. For example, February 1st, you're going to have the neurology exam. So neurology module 1, what all topics are included, module 2 date, module 3, module 4, and each of this exam will be followed by a discussion video. So it will help you to watch the video as well and to understand where you went wrong, or maybe even if you got it right, some extra points. Because see, what is the limitation I have in the ELITE exam when I conduct a module-based test? Well, I have limitation in the number of questions, but when I conduct the discussion part, I will stress upon a few more points which I think might be asked. So I would definitely tell you, not only going through the explanation that will be definitely given in the app as well, but if you have got time, go through the video as well, so that you will get some extra points. Okay. So similarly for neurology, cardiology, Kamal sir would be covering. He would be doing an exhaustive coverage as well of all the modules. So cardiology module, this will definitely be shared with you very soon. And after that, oncology part, we have divided to modules. Prashant Gandhi sir will be taking the medical gastroenterology, oncology by Hemant sir and Vijay sir. Prashant Gandhi sir will be discussing this one. And here again, when the specialist is discussing for medical group, not only will he be discussing the points on Harrison, but whatever important points are there from the corresponding super specialty textbook that is likely to be asked. For example, if Prashant Gandhi sir is asking or teaching you or discussing about hepatitis C, he would tell you this table from Schlesinger, I feel is important and you have to learn that. So please watch the videos as well. Dr. Karthik, he would be taking endocrinology, and you should definitely stay updated with him as well, because he's a very knowledgeable person. And you be in his WhatsApp group as well, which is very much active, so that you can definitely grow in knowledge. So this module is there. And then nephrology is there. Dr. Vivek Goyal, who is one of the masters of nephrology, I would say, someone who has a very good clinical perspective as well. You do not want to miss out on his discussions. So go through the nephrology part. Infectious disease, Dr. Nia sir, who has done his DM from AIMS Delhi. So again, a very established infectious disease specialist. And definitely you can watch his discussions as well. Hematology by Shinto Francis sir, who is the chief of the hematology in the hospital where he's working. So he'll be discussing the hematology part. His QRP sessions were also very much appreciated last time, with a few tough questions directly from his QRP as well. I'm not saying that, they have handpicked a question from his QRP, but the point is certain faculties will be able to anticipate, okay, if I was the examiner, what would I put? So that is why I think, watching videos is important, because many students ask me, sir, I know much of the stuff. Can I just practice QBank? But I think a teacher's guidance will help you pick up certain questions which you might actually feel are less important, or you might not actually see that in the Harrison tables as well. Okay. And in addition to that, we have questions from the rheumatology part, and we have a faculty joining for emergency medicine, critical care, faculty joining for pulmonology as well. So they will also be doing the separate discussions. So everything will be by the corresponding specialist, but this will be keeping in view the pattern of questions, and we'll be doing accordingly. Okay. So I think, I have discussed the 4 major headings in the session today. So the session was done in Zoom, and there was a technical glitch for the YouTube part, but we'll be just putting this in YouTube as well for candidates who want to watch this. So even if you're watching it later in YouTube, please feel free to WhatsApp me. Even if you're a medicine resident preparing and you want to know regarding how to prepare or maybe any help, please WhatsApp me. Sometimes there might be a slight delay in replying to the messages, but I'll definitely reply once you remind me once again, because all of us are definitely busy as well, like you, right?